Hi, our presenter today is Dr. Whitney Wharton from the Emory Nell Hodgson School of Nursing at Emory University. Her area, she's a neuroscientist, internationally renowned, who studies a lot of things that have to do with Alzheimer's. One of them in particular has to do with the hormonal effects, particularly as it affects women and Alzheimer's. Welcome, Whitney. Whitney?
Thank you so much, Dr. Parker. I appreciate the time today, and thank you to Marissa for setting all of this up. I will share my screen. Let's see. Okay, can you all see this okay?
Yeah, it looks good.
Okay, thank you so much. I think this is my 22nd BrainTalk Live, so thank you so much again for having me. And
Quite a few.
I'm sorry?
It's been quite a few.
It has been quite a few. So thank you so much again for having me. It's really great to be here again. And next week, you'll actually be hearing from one of the investigators that I'm going to be talking about today, Dr. Irene Yang. And I'm really excited for this talk. It's going to be a little bit different. I think a lot of you have heard me talk about women's health, caregiver initiatives, Alzheimer's prevention in general. But today I'm really excited to share a new initiative with you all that we're starting as a joint program with neurology, with the Emory School of Nursing, and a number of different institutions. And this program is called PREVAIL, and it's all about Alzheimer's disease prevention. And so this is the goal today is to roll out this new initiative and a new model. So before I start, I also will say in the bottom right corner of your screen right now, you should be seeing some contact information for a phone number, a QR code, and an email address. So if you would like information about anything that I'm talking about today, please feel free to contact us, and we will absolutely get right back with you. So for the overview today, I'm going to introduce the PREVAIL program, talk about the premise of prevention team research, introduce our team to you, talk about some of the procedures and the individual studies and trials that we have going on right now, and examples of how this new model might increase the amount of science that we're able to do and reduce the participant burden based on what we ask you to do, so that you can be in multiple studies if that is your choice. So we came up with the name PREVAIL because it stands for the overall premise of what we're trying to do, which is prevention and risk evaluation for vascular health, Alzheimer's disease risk, intervention, and lifestyle. And the PREVAIL team, as of now, is comprised of 3 principal investigators. And together we have 8 studies that are currently funded by the National Institutes of Health or other peer-reviewed institutions, which I will go over with you. And our goal for really combining these programs of research is to improve scientific discovery and increase enrollment in these observational studies and trials without increasing your burden for having to be or not be eligible to be in multiple studies. Hopefully you'll see a lot more of this PREVAIL Lab information coming out, but this is the logo that we have working right now. And again, this is a compilation of 3 PIs and multiple studies within 3 very prolific areas of research. So the idea from this sort of came because my mother has breast cancer and wanted to enroll in multiple studies, but some studies she was in a clinical trial, and if she was in this clinical trial, she was unfortunately not able to be involved in a few other studies. And some of you might have had that experience with clinical trials in general, maybe with Alzheimer's research. I hope not, but potentially. And when I was ushering my mother through her clinical visits and both her observational and her clinical trial, what I found as her caregiver and her, study partner in some instances was that they were asking her to do the same things over and over, asking the same questions over and over, taking some of the same vital signs and just tests over and over, which when she's going through this, the first time she was undergoing chemotherapy, so she didn't feel good. And so I'm really trying to reduce participant burden with letting you be involved in whatever you want to be with, whatever study you want to be involved with. So for an example, if you want to be in more than one study, and those study visits are happening at a similar time point, so within 1 to 3 months, and we're talking about, again, prevention, so cognitively normal individuals wanting to be in multiple studies, I don't need to ask you about, unless something changed, we don't need to ask you all of the same questions about your medication history, your reproductive history, unless something has changed. So what I'm trying to do is have researchers work together so that we share information while it's still completely anonymous, but to not ask you the same questions over and over. So if you're coming in for a visit on Monday and you want to come to a different study on Wednesday, we don't have to ask you these same repetitive questions. We don't have to take your height and weight again, little things like that to make your life easier. So, excuse me. So this is the study leadership team. I'm in the middle, and Dr. Brittany Butts is here on the left side of your screen. Dr. Butts is she has a PhD. She also is an RN, and she worked in the emergency room for a number of years, and her expertise is in vascular function, inflammation, and social determinants of health. On the right, you're going to see Dr. Irene Yang, who is going to be the featured speaker on the BrainTalk Live next week. And she also has her PhD. She's a registered nurse, and she is an expert in vascular risk factors, Alzheimer's disease biomarkers, and the oral microbiome. So she's interested in all of the same. So we all three of us are interested in very similar biological markers, but we all have our individual unique foci. I'm in the middle, and my interest is in Alzheimer's disease biomarkers, inflammation, sleep, and Alzheimer's prevention in general in under-resourced groups. And focusing on under-resourced groups and minoritized groups is something that I'll talk about a little bit later. We also have two leaders on either side in this next row. We have Dr. Karima Benamer, who is a board-certified neurologist. And if any of you have been with me on my team, participated in any of my studies before, she might have performed your lumbar puncture. She's also an expert in nutrition. And then on the far right, we have Dr. Lynn Marie Trotty, also a board-certified neurologist here at Emory, and she is a sleep expert. She also performs a number of the lumbar punctures that we do in our studies. And then in the middle, we have our organizational staff research team, which if you've been with our studies, you will be very familiar with Kelly and Danielle, and they've been with me between 3 Kelly's been with me for about 3 years, and Danielle's been with me for about 8 years. And then on this bottom row, you have our clinical research coordinator team. And the great thing about this team is that in the PREVAIL system model, you will work with one or multiple of these women. So you always know who you will be calling, you will be working with, who is going to escort you from the parking garage to the clinical testing room. It's always the same people across these 3 PIs. And I think that just makes the whole process a little bit less confusing, and also just facilitates all of our talking together so that we can expedite the research and get you involved in as many projects as you want to be involved in. In addition to the leadership team, you will be working with the PREVAIL team, a quite literal army of experts. So we have experts in neurology, neuropsychology, neuroscience, genetics, women's health, neuroimaging, and also people in some, specific foci like oral health, caregiver stress, discrimination, sleep, health disparities. But this is the members of the team that are already involved in our research, in the PREVAIL research project. And there's a lot that I'm not able to cover today, but this is sort of the team of experts behind the PREVAIL projects. So the focus of the PREVAIL team is on Alzheimer's disease prevention. So across all of the 8 studies, which I will just highlight portions of each, we are interested in recruiting individuals who are at high risk for Alzheimer's disease, but as of yet are cognitively normal. My main goal is to keep individuals as healthy and independent and improve quality of life in people for as long as possible, in order to not have to not have to have you on a medication to cure Alzheimer's disease later. So it's all about prevention. We also have a very person-centered approach. So the focus of the program in general has a number of different foci. We are a very translational project, so we are very biomarker heavy. A number of our studies do collect cerebrospinal fluid via lumbar puncture. We collect blood. Some of our studies involve MRI, and we are interested in inflammation, sleep. Also, we have clinical trials with caregiver education, oral microbiome, estrogen, vascular risk factors, and things like this. But these are just the topics that we all go over. Excuse me. But again, we combine forces so that we don't have to ask you the same questions over and over. So again, the highlights: everyone in all of our studies, our inclusion criteria is cognitively normal but high risk individuals age 40 to 90. None of our studies require a study partner because everyone is cognitively normal at baseline. Something I think unique about us is that we don't deal with pharmaceutical trials. So while we do have both clinical trials, observational studies, and lifestyle interventions, none of us are involved in pharmaceutical trials. So we're really interested in using the tools that we have to expedite and prevent Alzheimer's so that we bypass that clinical trial sort of burden for people. A lot of our studies are observational and longitudinal. We had a participant in not too long ago who just had her 8th lumbar puncture with us, and she's been with me for more than a decade now, and she's been in 5 different studies. And, the benefit of doing that observational study is that we track vascular health via ultrasound, we track cognitive testing, and we track these biomarkers so that we are able to tell you if there's something that we would not expect based on your age and your education, your gender. Then you would get a call from us. We do have both lifestyle and a type of clinical trial where, again, we're not involved with any sort of pharmaceutical trials, but we're interested in repurposing either existing FDA approved medications like blood pressure medications, or we have one clinical trial right now, which some of you have probably heard me discuss, where we're looking at the benefits of supplements, which in this case is soy. We know that that's beneficial for women and very likely beneficial for men as well, especially men over 65. So I'll talk a little bit about that. But for our lifestyle interventions, and this is again under the PREVAIL umbrella, we have lifestyle interventions which focus on caregiver education, tango dance, and similar lifestyle interventions. And we try to make these interventions such that they're things that people want to participate in. And we think that these could have lasting impacts on not just vascular health, but on brain health. All of our research studies, whether it's a longitudinal observational study or a lifestyle intervention, we try to enroll an overrepresentation of individuals from under-resourced or very high-risk groups. And for us, that means women, family caregivers and friends caring for someone with Alzheimer's disease, African Americans, and the LGBTQ community. Also, I think something that is important to note is that all of our studies are peer-reviewed. So they are all funded predominantly through the National Institutes of Health, the Alzheimer's Association, and other organizations where they go through a very rigid and very stringent peer-reviewed application process. And then especially in the case of our clinical trials, even though we're combining resources, you still have different participant numbers for different studies, and you are sort of triply protected, for lack of a better word. One of the highlights also of the PREVAIL program is that we're able to leverage resources. Again, this is mutually beneficial for the science and for you. So, for instance, by contacting us via the QR code or the email or the phone number in the bottom right, I know exactly who you will be calling, and we're able to combine personnel, procedures, the location of everything. Everything happens on campus, not only in the same building and on the same floor, but in the same rooms, the same rooms. All three PIs have also combined forces to ask you the same cognitive testing questions, so that if you come in for one study, that cognitive testing, that hour-long cognitive testing that you undergo, can be used not only for one study, but we can use that, assuming that it's close in time, we can use that for other studies. And as I mentioned, for questionnaires, I don't have to ask you about your long-term medical history every single time you come in. We can just ask you that one time and ask you for all of these studies to update it annually. We rely very solely on community-based recruitment. We have very active engagement based on participant requests. So for instance, this weekend we have a recruitment event. Next weekend we have 2 recruitment events. And some of these are events based on organizations that you recommend to us and just say, would you mind coming to our church? Would you mind my My community has a health fair going on. I'm a part of a women's group, and we would love to hear about women's health. By forming this sort of coalition of investigators, we spread out the expertise such that if you want to hear about something for your own specific group's purposes, we are able to accommodate that. This is 100% free. We do this almost every weekend, and that is something that would be available for you. We also work very closely with our community partners for almost every study. And for the PREVAIL project in general, we have a community advisory board. We have both national and local advisory boards. And we work very closely with the Alzheimer Association, the VA, AARP, the Healthy Heart Coalition, and a number of others. This weekend, for instance, I'm going to be at a location where they're showing the play that is focused on African American caregiving and how that impacts the family in general. So that's something that we're doing this weekend. And if you're interested in any of these, please reach out to us. We also have what we present you with is sort of a menu of options based on your time, your availability, individual inclusion and exclusion criteria for each study. And you just let us know what you're up for. And if you're not, interested in something right now, at least you have that information that you can disseminate to others, or you can just sit with that information, think about it for a little bit. And when you're ready, we will be here for you. So we're happy to do that. We're also very happy, again, to share the information that we work, again, very closely with the Alzheimer Association. So if there's a caregiving resource, we have that. For every participant that is involved with the PREVAIL study, you get one-on-one time with the principal investigators of that study. So that would be one-on-one time with me, with Dr. Yang or Dr. Butts, or a compilation of all of us, depending on what you like. Again, we're not trying to take up too much of your time, but I do feel like it's important for the principal investigators, the leaders of the study, to have that one-on-one time with you. And something that we hold very close to our program is reporting back. So it's very important for us, for you to know, and not just know in general, but you to be the first person to know what has happened and what results have been gleaned based on your individual participation. We have quarterly newsletters that go out. We have a website where we publish, of course, for free, any study in a medical journal, any project that a student might present, any abstract or presentation at a research convention or a conference. All of that is on our website. And then we also hold, every 6 months, we hold participant appreciation events, which I assume some of you on the call have been to. And what that is just, it's an event where we invite everyone across the whole PREVAIL spectrum, everyone in all studies, to come in, and we give you the results first based on what has happened in the past 6 months. So we also have a number, we feed you lunch or feed you brunch, invite you to come in. This is the same place where you have the visits. We invite your family, where you invite your friends. Also, we have tabling, again, the Alzheimer Association, AARP, Healthy Heart Coalition. All of these groups have been to our participant appreciation events. And we also have a number of 20 to 30 minute talks. And those topics are based on what you tell us that you want to hear about. So this past, in April, we had a participant appreciation event, and we talked about stress, we talked about nutrition, we talked about sleep. And then I think what our participants have told us that is most beneficial is that we have a very open forum Q&A session where all of the speakers and all of the PIs sit on a panel, and we answer for as long as it takes, as long as you all want to stay there, any question that you have. And that can be a question about Alzheimer's or dementia in general. It can be about any of the topics that were presented. We had a lot of questions this year, for instance, about the new medications that were coming out about for Alzheimer's disease. And any questions, for me or for the other PIs about results that have happened thus far. We also give you results from every year, the International Alzheimer's Association conference, which we just got back from, which happened in Philly this year in July. So we want to be sure that you have all of that information, but that's also posted on our website. This is just a picture of what we might introduce to a potential participant that might be interested in taking part in our studies. So across all of our studies, we have a number of outcomes that we're looking at. We look at vascular function, which is heart health and how elastic your blood vessels are. Some of our studies involve MRI. If you have claustrophobia, for instance, we will negate that, or that just may be not a study for you. And that way we know where to direct you and maybe advise that you might want to participate in a different study. We have studies for people specifically who are having some sleep complications. This is very common in women who are either going through or have gone through the menopausal transition. And as I mentioned, we have experts in sleep, and what we're finding from research studies is that sleep is so vitally important that this is something that we offer you if this is part of the menu of procedures that you're willing to undergo. And we also have blood collection, spinal fluid collection, if that's something you're interested in, and cognitive testing. Again, if some of these give you pause, for instance, the spinal fluid collection, there's other studies that you can be in. You don't have to do the spinal fluid collection, but if you're something you're considering, then we put you in contact with someone that is, like, for myself, for instance, is able to discuss this with you, and we kind of just take it from there. This is a picture of our team focusing on our community-based research this past couple of months. I know I'm running out of time, excuse me. And then, I have 4 studies that are currently ongoing, but if you wanted to give us a call, what my team will do is essentially run through the menu of options with you, and you can decide what works with your interest, what works with your time. Some of these are 100% online. Some of these are more involved and in person. And again, some of these are clinical trials where we're, again, looking at the off-label use of things like soy that might be helpful. So I will, and this is the investigator who you're going to be hearing from next week, which is Dr. Yang. And she's going to be talking to you about oral health, but this is the last thing I wanted to talk with you about very quickly. I'm sorry, Dr. Parker, I know that this is, I'm running kind of close.
No. I just wanted to draw your attention to one of the questions in the Q&A. I couldn't answer this one. People are asking, what testing results are you going to share with the participants? So
sure, that's a great,
yeah. Give them that answer in context with the studies that you're advising, because I was talking about the sex ones, because that's the hormones, excuse me, the
yes.
one, but that's the question I wanted you to address, please.
Yes, absolutely. So if it's okay, first I might just talk about this one really, really quickly. So this is just an example of someone that came in this week for the PREVAIL project, but is actually involved in 3 different studies. So this person was in the E2 study, the CARDI study, and the oral study. Now, because we overlap so much, these are just examples of flyers. The person coming in had they had cognitive testing, they had lumbar puncture, they had a vascular ultrasound. They took the sleep monitor home with them to wear it, and they answered questionnaires. Now, they also enrolled and were consented to the CARDI study. And by doing that, they had to do nothing extra, nothing. It is one extra tube of blood, and we take that extra tube when the needle is already in your arm. So there's essentially nothing extra that that person had to do other than being consented for CARDI. Now, for the orals project, also completely overlapping, same time frame, same number of visits, but the only added extra for the orals project is that that person got a free oral orthodontal exam. They had to drool into a tube, and this took about an extra hour for that person to do, including the extra about 10 minutes of questionnaires that they had to answer. But the benefit for doing this is, again, we combine each of these studies standalone involves the same cognitive tests. We look at a lot of similar biomarkers. So we're all looking for Alzheimer's biomarkers in blood and in spinal fluid, but because you already did that for the E2 study, we don't have to stick you again for the other studies. It's one time. Or if someone just wanted to be in the CARDI study, there's no lumbar puncture in general. However, you will be compensated for each of these studies. So if someone was just in the E2 study, for instance, at each study visit, we give you $100 because we know it's time out of your day and you have to travel to get to us. So that's $100, but just by consenting to CARDI, that person gets an extra $75. And then by consenting and doing the oral exam for the oral study, they get an extra $100. So by combining all of these, we're combining resources, combining the cognitive testing, combining the questionnaires, and someone walks out of the testing room with $275 as opposed to $100. And I know no one on this call does this for the money, but it's always the same thing with all of us. We're trying to make all of this, we know this is a big ask. And so we're trying to make this as easy for you as possible. And, while I don't deal in pharma studies, it's important for me to compensate you for everything that you are doing. So that is one incentive that we are able to do by combining these. As far as information that we give back to you, essentially you can request legally almost anything that you want to request. We sent a MRI disc we sent today to one of my participants. I had to have a phone conversation with her, making sure that she knew that this was a research study and that unless someone, was in a car accident or we suspected that she had some sort of stroke, this was not a clinical scan. So this was a different type of MRI, but if you request it, we can do that. If I notice, especially with, for instance, someone that's been with me for a number of years, if I see a change on someone's cognitive testing, because everyone starts as cognitively normal, if I see a change based on every year on that person's cognitive performance, then I call them and we handle it however you want to handle it. Some people say, I would like you to have me back in as soon as possible, and I would like to have a clinical evaluation. We can do that. Some people say, I would like you to send me the results, and I would like to keep research totally separate from clinical care. We can do that. Some people say, I would like for you to send me my results, and I would like to have a three-way conversation between you, the participant, me, and their provider. And if they don't have one, we get one for you. Done. However you want to do it. People choose all different options for a number of different reasons. And sometimes people just want to wait till the next year, and that's fine too. But my point being, the ball is in your court. Other things that we do is on our vascular ultrasound specifically, if we see something that gives us pause or something for which you will need to seek or you should seek clinical care, we let you know. If you want the results of your sleep profiler, how you sleep overnight, especially how we track that over the years, you can have that. You just let us know what you need, but regardless of what you might want, if it's something that is clinically relevant, those results are going to be given to you by me. And I will stop sharing right now and be happy to answer any questions that anyone might have. I know we're getting close to time. I went over, excuse me.
Whitney, if you'll just look at some of the things under Q&A, there are like 4 different questions that are specific to your studies. I'll start with the one from Ms. Mona Moore. We just did that. What testing results are shared with participants? Okay. Get the cerebral spinal fluid results. I guess you can explain that, but if you would go through those for me, the ones I can answer, I've answered, but the ones I can't, I'm letting you do.
Sure. So for the spinal fluid, oops, did I just freeze? Can you hear me?
I can hear you. You're good.
Okay. So for the spinal fluid results, that is not something that is clinically that is now right now used in clinical care for people that are cognitively normal. Now, if you were going to go into a memory clinic where you presented with either a mild cognitive impairment or you were having a memory concern, then that lumbar puncture would be the spinal fluid results would be something that they would use to help with the diagnostic process. Can you hear me, Dr. Parker?
Yes, I can hear you.
Okay. But that is not something that that we do with our research projects, because it is not yet in the vein of being helpful for you.
Okay, so there's another one from Mr. Cross. If a person is 72, do they only qualify for E2?
No, we have, you would probably qualify for about 7 of our 8 studies, just based on that number. So that is not a problem. And if you wanted to give us a call, we could walk through the options with you and see what is your interest and what works for your time.
Miss Margaret Holloway. How does one determine whether they are high risk enough to participate in the study?
Sure, that's a great question. And you know, I would imagine by being on this call that many of us are at risk because there's some reason that we want to hear this information. I'm personally at risk because I'm a woman, because I have a family history and have a family history of a number of different conditions that would increase my risk for dementia and Alzheimer's disease specifically. We also have studies that don't just look at people who are at the highest risk. So for us, it's essentially sort of come one, come all. But because people are, you know, cognitively normal, there's a reason that people want to participate in Alzheimer's disease research when you could be in a study for anything. You could be in a study for cancer or you know, transplantation or any sort of clinical trial, environmental factors, something brought you here. So I would imagine that that would be, you know, just gender, just age. Those are the 2 biggest risk factors for Alzheimer's disease. So I would be happy to go over those with you if you wanted to give us a call.
Okay, and for people who are excuse me, interested in the study, in the chat, we have the Wharton Lab, the email. You can say Wharton, capital WHARTON lab at Emory, EMORY.edu. And I think a couple of slides ago, there are some QR codes, excuse me, that you can use to look at the different menu of studies. And Dr. Wharton studies are really what we call observational studies, and we're looking at what factors into preventing Alzheimer's, correct, Whitney?
Correct. And we also do have 2 clinical trials going on right now. So while they're not pharmaceutical trials, like for instance, we have about 372 people enrolled thus far in our ACE clinical trial. And that study is looking at the potential benefits in individuals who are 65 and over to take this soy supplement every day. And that does not involve a lumbar puncture, but we're looking at vascular function, cognition, and MRI in these people over 2 years. And that is currently enrolling, and we have about 20 slots left for that clinical trial, if that's something that someone is interested in.
There's a question under the QA section, Dr. Wharton, that says, if we are high risk for dementia, from Jennifer Murray, is it possible to find a doctor to confirm high risk status and for regular and/or annual checkups to track cognitive function and obtain ongoing advice? My primary care doctor just gave me a 3 to 5 question test, and I think I need more focused support.
That sounds pretty typical to me, unfortunately. That sounds like you went to an abbreviated wellness visit and Dr. Parker is probably the expert in this area, but regardless of what study or what program, Ms. Murray, you participate in, I think one of the benefits of research, especially if you want to be in the PREVAIL study, is that you do get that one-on-one time with the PI that has this, again, army of experts with experience and medical and research expertise in all of the topics that you covered, from diet to exercise to sex hormones to sleep. And we would be happy to give you all of that information. If you wanted to contact us. All of this also is something happened with my internet right now, so I'm not sure exactly what's happening with my internet, but if you go to whitneywhartonlab.org, we have information on all of these topics, both medical information and information from our team of experts. So